One of the things that worries me the most in my office is when I hear someone say, "Doctor, I never used to wake up at night to pee, but now I get up 2, 3, even 4 times. Is this normal?" And what truly scares me is that most people simply ignore it, thinking it's because of aging, cold weather, drinking too much water, or in the case of men, they immediately blame the prostate. Sure, those can be reasons, but behind this discomfort hides a silent villain that most people would never suspect, and its name is diabetes. When blood sugar levels get too high, the body desperately tries to get rid of the excess, and one way it does that is by flushing it out through urine. Glucose starts pulling water from your cells, which leads to dehydration, making your body crave more fluids, so you feel constantly thirsty, and of course, you start getting up several times during the night to urinate. And this is not just an inconvenience. This is a serious warning sign that your body is struggling to maintain balance because it can't handle the excess sugar in your bloodstream. Now let me ask you, when was the last time you had a simple fasting blood sugar test or an A1C test that shows your average blood sugar over the past 3 months? I've seen plenty of patients walk into my office thinking it's just a prostate issue and leave with a diagnosis of prediabetes or even advanced diabetes without having the slightest idea. And yes, I know you might be thinking, "Doctor, maybe it's because I drink a lot of water before bed." And that could be true, just like it could be from a diuretic tea or some medication you're taking. And for men, yes, it could be due to benign prostate enlargement. But here's a frightening fact. Out of every 3 people with prediabetes, 2 have no idea they are sick. And the scariest part is that those who ignore these warning signs are heading straight toward the most dangerous complications of diabetes, like kidney failure, amputations, heart attacks, and strokes. And let me tell you something. You probably didn't know this was exactly one of the first warning signs that showed up in Elvis Presley's life before his health completely collapsed. Most people think he died only because of drug issues or obesity, but very few know that he also suffered from metabolic disorders, insulin resistance, and complications that at the time were barely talked about. You wake up multiple times, can't rest properly. Your immune system weakens, your stress levels skyrocket, your appetite becomes erratic, and the risk of gaining weight, developing high blood pressure, high cholesterol, and of course progressing to a more serious diabetes keeps increasing. That's why I'm telling you with absolute certainty, this small sign that most people ignore could actually be your body's silent scream desperately asking for help. The choice is completely in your hands. Either you investigate now while there's still time to take control, or you risk finding out the hard way when complications are already knocking at your door. And if you think this doesn't happen to that many people, listen, in Brazil alone, over 40 million people are already living in a pre-diabetic state, and most of them have absolutely no idea. Even worse, many only find out after serious damage has already occurred, like kidney problems, vision loss, nerve damage, or even a heart attack. If this is happening to you, don't treat it as normal. Get your tests done, pay attention to what your body is trying to tell you, because I guarantee those who act today, who take care of themselves now, can absolutely avoid the worst and even reverse this condition. And I'm here exactly to help you through this journey. Have you ever noticed that as evening falls, your vision starts getting weird, lights appear blurry, driving at night becomes uncomfortable, and even reading texts on your phone feels harder? And of course we try to come up with excuses. Maybe I'm just tired, it's the phone's fault, maybe I'm getting older. But let me tell you something very serious. This blurry vision that usually shows up at the end of the day or at night can be way more than just a simple eyesight issue. It can be a very clear warning that your blood sugar is out of control and you are either entering or have already stepped onto the path of diabetes. When blood sugar levels get too high, it throws off the fluid balance inside the eyes. The lens in our eyes, called the crystalline, starts to swell, and as it changes shape, your ability to focus becomes severely compromised. That's why suddenly road signs look blurry. The movie you're watching starts looking strange, and even staring at the computer screen becomes uncomfortable. And here's something very few people know. Diabetes is the #1 cause of blindness in adults worldwide. And I ask you sincerely, do you really believe it's just coincidence that you wake up every morning struggling to see clearly, or that everything looks foggy when night falls? It's not. Your body is sending you very clear signals. This change in vision is often one of the first warnings that your blood sugar is dangerously high, and it's already damaging very sensitive parts of your body, like your eyes. Do you know who went through this? The famous chef Jamie Oliver. Yes, the same one known worldwide for his fight against unhealthy eating. What most people don't know is that at the peak of his career, he received a very serious warning from his doctor that he was quickly heading towards diabetes. Just imagine his story isn't just about him. If you don't act now, the same thing could easily happen to you, and that's exactly why I'm here right now, to help you avoid the worst-case scenario. One of the first warning signs he noticed was struggling to see clearly at the end of the day, especially after filming, when the lights started fading. That was the wake-up call that made him completely rethink his relationship with food. Can you believe it? A chef who spends his entire day surrounded by food nearly ruined his health because of poor daily choices. And the most worrying part, if you ignore it, if you pretend it's not happening, the condition doesn't just get worse, and it can become completely irreversible. This is what's called diabetic retinopathy. It happens when the tiny blood vessels in your retina, the back part of your eye responsible for forming images, start breaking, leaking blood, creating scar tissue, and causing gradual vision loss. Have you ever thought about how your life would be if you couldn't see? Could you care for your family? Could you work? Read a simple WhatsApp message? Look at the face of someone you love? Sadly, most people only realize the value of vision when they start losing it. And don't think this only happens to people who've had diabetes for years. Let me make this very clear. Just a few months of uncontrolled blood sugar is enough to trigger this problem. The scariest part? It often starts quietly, subtly. A little bit of blurry vision here, a bit of trouble focusing there, and by the time you notice, part of your vision may already be damaged. Maybe right now you're thinking, "Oh doctor, it's probably just my glasses, maybe my prescription got worse." But no, don't fool yourself. This is something completely different. Sure, aging brings natural vision changes like presbyopia, where you have to hold your phone farther away to read. But that has nothing to do with blurry night vision, discomfort in low light, or struggling to focus when it gets dark. That's why I'm telling you from the heart. If you've noticed that your vision feels strange, especially at night, don't wait. Get tested. Check your fasting blood sugar and your HbA1c levels, because most of the time this is just the beginning. If you catch it now, you can control it, reverse it, and stop this problem from becoming a tragedy in your life. And you know what's truly heartbreaking? So many people only find out when they visit an eye doctor and discover that part of their vision is already gone or their retina is damaged. Even worse, some people believe that changing their glasses will fix it. But no, it won't. Because the problem isn't with your glasses, it's in your blood. It's high blood sugar silently destroying your ability to see. So if you've noticed that your vision gets worse, especially at night or when it's getting dark, if driving feels uncomfortable, if reading or watching TV has become harder, don't wait for it to get worse. I guarantee you, if you don't take care of it now, tomorrow might be too late. It's just like that awful moment when you're peacefully sleeping and suddenly a sharp cramp hits your leg, jolting you out of bed. That sudden intense muscle spasm that shocks you awake. It's painful, uncomfortable, and always happens without warning. But here's the thing. That kind of cramp isn't just an annoying inconvenience. It's a warning sign from your body, screaming that something is wrong inside. When blood sugar is out of control, electrolyte imbalances and nerve damage make these painful cramps happen more often. And no, it's definitely not something you should ignore. Sadly, many people brush off these signs until they turn into something much more serious. And then they regret not paying attention when their body first warned them. That's why I'm telling you again, seriously. If your vision feels weird or if you're getting night cramps, don't take it lightly. Check your health, not tomorrow, not later, right now. Just by keeping an eye on your blood sugar, getting the right tests and taking care of yourself today, you can prevent major problems down the line. This isn't just for you, it's also for the people you love. A simple decision you make today could completely change your life a few years from now. So don't wait. Start now. Your health is your most valuable treasure, and you need to protect it today, not tomorrow. Neither diabetic retinopathy, nor blood sugar problems, nor those horrible leg cramps are unbeatable. Everything can be controlled if you start today. Your health is in your hands. And remember this forever. Health isn't something you regret losing. It's something you fight to protect while you still have it. You deserve to be healthy, and you absolutely can make it happen. The worst part is that this keeps happening night after night, and you're left completely confused, wondering what's going on. If this is happening too, you know that this is absolutely not normal. That discomfort you call a cramp, that painful muscle contraction, waking you up in the middle of the night, is much more than just lack of stretching or potassium. In reality, it could be one of those warning signs your body is desperately trying to send you, and ignoring it would be a huge mistake. Because yes, this is a very clear symptom that your blood sugar is not under control. Let me explain this in the simplest way possible, so you understand exactly how this happens inside your body. When your blood sugar levels are high, something occurs that most people don't even know about. The excess sugar in your bloodstream starts pulling water out of your cells, and along with that water, your body also loses essential minerals that are crucial for your muscle health, like potassium, magnesium, and calcium. And do you know what happens next? Your muscles become dehydrated. They run low on those vital electrolytes, and as a result, you start experiencing spasms, involuntary contractions, and of course, those dreaded cramps. But it doesn't stop there. Diabetes also directly impacts your circulation. High blood sugar damages your blood vessels, reducing the flow of oxygen and nutrients to your muscles. And if that wasn't enough, it also harms your nerves through a process called diabetic neuropathy. And when your nerves can no longer send the correct signals to your muscles, guess what happens? Your muscles start contracting uncontrollably, waking you up in the middle of the night, sometimes screaming in pain, twisting your body desperately, trying to figure out how to relieve that unbearable suffering. And trust me, this isn't something rare. Do you know who went through this? Robin Williams. Yes, the genius of comedy who made the entire world laugh was silently battling multiple metabolic issues, including type 2 diabetes. Even though he always showed a smile in public behind the scenes, he was constantly struggling with physical pain, neurological problems, and these horrible cramps that completely destroyed his nights. So I'm asking you from the bottom of my heart, do you really want to wait until life teaches you this lesson the hard way? Don't fool yourself. A cramp isn't just that annoying thing you fix by eating a banana. It could actually be your body screaming, telling you that your circulation is compromised, your muscles are starving for nutrients, and your nerves are already failing to function the way they should. And the scariest part is that this doesn't just rob you of your sleep. It also leaves you feeling more exhausted, more irritable, more stressed every day, and traps you in a vicious cycle where the less you sleep, the more your metabolism becomes completely out of control. And the more your metabolism gets worse, the more these symptoms intensify. Now pause and think with me. How long have you been feeling these nighttime cramps? Do you really believe it's just because you didn't drink enough water? Or is it possible that deep down your body has been sending you these alerts for months, maybe even years, and you either didn't notice or chose not to pay attention? What worries me the most is that so many people normalize it, thinking it's because of age, working too much, or spending too long standing. Yes, these factors may contribute a little, but when cramps start happening more frequently, especially at night, it's a clear warning sign, because this is far from normal. And let me tell you something, even more serious cramps are just the beginning. If you don't take care soon, you'll feel burning feet, tingling, numbness, extreme fatigue, and the complications won't stop there. I speak with complete honesty. Many patients who come to my clinic complaining about night cramps end up discovering through tests that they are pre-diabetic or already diabetic without even realizing it. That's why you should never ignore or underestimate it, because every time you wake up with that stabbing pain in your leg, with a muscle as hard as a rock, it's your body screaming that something is very wrong. You have two choices. Either pretend it's not happening or act right now while there's still time to reverse it, and stop it from turning into a much bigger problem in the future. Have you ever felt like your feet are burning like two hot coals so intense that you don't even know whether to keep them under the blanket or stick them out? And the worst part is, this usually gets worse at night, exactly when you need to rest the most, and I'm telling you, this is really far from being normal. It's not just because you stood for too long, or because it's cold, or because your mattress is bad. This burning in your feet, the tingling, the stabbing pain, or even the electric shock feeling is a very clear sign. It's a sign that diabetes has already started affecting your nerves. It's what we call diabetic neuropathy. And what shocks me the most is that it often starts so subtly that people don't even notice. At first, it's just a slight discomfort, a strange warm feeling, a little tingling here and there. Then it starts bothering more until one night you simply can't sleep anymore. You toss and turn in bed, pull the blanket off, put it back, change positions. Try putting your feet on the cold floor and nothing works. Because the problem isn't the temperature or the mattress. The problem is inside your own body. Your nervous system is being quietly destroyed by the excess sugar in your blood. And I sincerely ask you, how long have you been feeling this, pretending it's nothing? How long have you been telling yourself, oh, it's just tiredness tomorrow, it'll be fine? Because I guarantee you it won't. It only gets worse. If you don't act now, this burning pain can turn into something far more serious and disabling. I've seen patients who started with this discomfort in their feet and years later had wounds that wouldn't heal, constant infections, and even amputations. And believe me, I'm not exaggerating. This is the harsh reality I see all the time in my clinic, and to show you how serious this is, studies show that more than half of people with diabetes develop some form of neuropathy. Most people only realize the problem when it is already too late, when the damage is done and the pain becomes a constant companion day and night. The saddest part is that this could have been completely avoided by simply controlling blood sugar, changing daily habits, eating properly, exercising and losing weight. Just by managing this silent enemy, which is high blood sugar, so much suffering and pain could have been prevented. And if you believe this only happens to elderly people, let me tell you that is absolutely wrong, because this does not care about your age. Do you know who went through this? None other than Ronaldo, the phenomenon, the football legend, who amazed the world with his extraordinary skills. After retiring, he revealed that he had to fight a very tough battle against insulin resistance and all the terrible consequences it brought to his health. And believe me, one of the things that bothered him the most was that constant burning sensation and the endless discomfort, especially in his legs and feet. Now let me ask you, do you really want to wait until it gets that bad? Do you really want to keep pretending that this is not happening? Because let me tell you, this is not normal. It is not an exaggeration. It is not something silly. It is your body literally screaming for help right now. And what upsets me the most is seeing how so many people suffer. Silently, they feel the pain, but they do not talk about it, thinking it will just go away. Some just buy any cream or menthol spray, wear thicker socks, try anything to relieve the discomfort, but they never look for the real cause. They do not check their blood sugar. They do not look at their hemoglobin, A1C test, and meanwhile the problem keeps growing and getting worse. And when they finally realize it, sometimes it is already too late and there is no turning back. But today I am here to tell you very clearly, there is a solution. You can stop this damage, you can change this situation. But the choice is 100% yours, because your body has been asking for help, sending you warning signs for a long time. If you ignore these signals, the price you will pay in the future will be much higher than anything you can imagine. Believe me. That is why it is extremely important to listen carefully to what your body is trying to tell you, and act right now while you still have time. If there is one thing I want you to remember from this video, it is that your body does not send signals by accident. Every single symptom has a reason. Waking up several times at night to urinate, blurry vision at the end of the day, cramps that wake you up, or that terrible burning in your feet. None of that is normal. These are silent screams from your body, warning you that something very serious is happening inside, and you need to act before it gets worse. The sooner you understand this, the better your chances are to avoid serious complications, and you can even reverse this situation completely. If you made it this far in this video, it means you have already taken the first step, and I truly congratulate you for that. The next video is already waiting for you right here on the screen, where we are going even deeper into this journey to help you improve your health and your life. Thank you so much for being here with me. Take care of yourself, and I will be waiting for you in the next video with all my heart.